Good afternoon. Welcome to our webinar titled Tips for Mental Health Wellbeing Amidst the COVID Lockdown. The world is witnessing an unprecedented crisis in this century, with the global lockdown and the pandemic affecting a few billion people around the world who have been confined to their homes, cut off from regular lives, and some of them barely prepared to stay home indefinitely. There are others who have been stranded at remote locations away from their loved ones and support circles. Yet now, with the world adapting to this new normal, these hard, uncertain times have naturally caused a great deal of mental anguish, and there have been rising rates observed in anxiety, stress, and depression. It is in times like these that we need to develop and cultivate resilience to cope with whatever life throws at us. To help us address all such situations and questions, and to offer advice and tips on how to take this current situation in our stride, it's our pleasure to have with us a team of experts from Médicins Sans Frontières, Doctors Without Borders, an international organization awarded with the Nobel Peace Prize for their pioneering humanitarian projects across the globe. This will also be one of the first few events officially hosted by the MAHE Wellness Hub, and I would like to invite Professor Elsa Ashish, head of the MAHE Wellness Hub, to introduce the initiative and its objectives to better the quality of life on campus. Over to you, Elsa.
Thank you, Sarah. Welcome and thank you for being here. It gives me immense pleasure to introduce the MAHE Dubai Wellness Hub to you. The Wellness Hub is here to complement the academic mission of our university. Our focus is on the overall well-being of each and every student. And overall well-being include physical, intellectual, social, and emotional well-being. Now the question is, what do we do? We organize awareness programs like the one you're just attending. We also offer counseling services. We have certified mental health first aiders on board. We also have consultants for physical and nutritional well-being. Today, I'd like to emphasize that our topmost priority is on mental health and emotional well-being. Sadly, there is still a stigma around mental health. Though mental health is just as important and valid as physical health, people are often embarrassed to talk about it. If anyone out here feels this way, I want to remind you that this works exactly like physical health. If you're experiencing a headache or any physical distress, that does not define you. And it's something you feel or experience for a while. It can be treated and then you feel better. Similarly, you and your emotions are two separate entities. What does this mean? If you're sad, that does not make you a depressed person. If you're worried, it does not make you a worrier. It is what you're feeling at one point of time. It doesn't define you as a person. And just like physical health, you can seek help to feel better. And this understanding is essential. Throw the stigma out of the window. At the Wellness Hub, we hope to create a culture that encourages conversations about mental health and invalidate any such stigma attached to it. And this is important now, more than ever. We are in extraordinary times. We are all fighting a pandemic. Stress, anxiety, uncertainty. We have experienced these feelings even before COVID-19. But physical distancing and isolation are not natural for us. And because of these feelings can be amplified. So while we take protective measures like social distancing to take care of our physical health, we must be mindful of our emotional and mental well-being. And this is why, despite the lockdown, we decided to launch the hub immediately and start offering services to you. So if you're finding it difficult to cope, you're concerned about your mental and emotional well-being, do reach out to us at the email mentioned here. We're here for you, and be rest assured that all your communication with us, including your identity, will be kept confidential. And now, before Sarah takes over, I would like to thank MSF, Doctors Without Borders, for coming on board, co-hosting this webinar with us. Thank you, Mario. Thank you, Tanya. Looking forward to a great session.
Thanks, Elsa. So excited to have the MAHE Wellness Hub as an integral part of the campus now. Before we start the session, I would just like to request all the attendees to start typing in their questions that might pop into their heads at during the course of the webinar before we actually open out the interactive session. And I would now like to introduce the Executive Director for Médicins Sans Frontières UAE office, Mario Stephen. Mario brings over 15 years of experience in the humanitarian sector with him, having worked with a number of international organizations in a variety of contexts. He has worked and lived in the Democratic Republic of Congo, Kenya, Afghanistan, Somalia, and Egypt. At a regional level, Mario has held positions covering Eastern and Southern Africa, the MENA region, and the Gulf. Mario first worked with MSF in 2009. He holds a master's in business and management administration from the Kedge Business School, Bordeaux, France, and an accreditation as a professional trainer from the Chartered Institute of Environmental Health, UK. Over to you, Mario. Welcome.
Thank you very much. Allow me just to start very quickly by thanking all the attendees for being here, by thanking Manipal Academy of Higher Education for giving us this wonderful platform. And may I wish a bit in advance, for sure, Eid Mubarak to all those of you who have been fasting, who are observing the holy month. Wishing you a wonderful Eid and hopefully a rapid resolution of this confinement situation we are all in. I'm going to start by giving you a small idea of what our organization, Doctors Without Borders, is doing today in general, but more specifically in regards to responding to the COVID-19 pandemic. Next slide, please. So we have been with you guys before, but in case you wouldn't know who we are or you still have questions about what our organization does, we are an international medical organization. We provide medical relief regardless of culture, religion, creed. All the victims of war, of disease, of natural catastrophe, of epidemics are basically our patients. Next slide, please. Our organization today, as you can see, is quite a big one. We started as a very small unit almost 50 years ago in 1971 in France, and we have grown to become the international movement that we are today. As you can see from the figures, we work in over 70 countries. You can see them in red on the map. Our staff is almost 50,000 today around the world. And I would also like to attract your attention to the fact that we are now, for this COVID pandemic, responding in places where we are headquartered, in France, in Italy, in Switzerland, in Norway, in Spain, places to be very honest, we never thought we would be running such an operation. But I would like to highlight that to introduce the COVID topic and our response to it, but also to highlight our response capacity and the fact that we will respond wherever is needed. Next slide. As our international president said, Dr. Christos, COVID-19 is a global health emergency, and responding to emergencies is in our DNA. I have to say that, like many of us, if not all of us, our life was completely changed and switched over by this pandemic. I want to say that the strength of this virus lies in its weakness, if you would allow me to say so, in its weakness in the sense that this is not in appearance, a deadly virus that will hit you and that will condemn you almost to a certain death. This is a virus that is spreading. A lot of people will carry it without displaying any symptoms. People who have compromised immunity will be suffering from it. Different age, different populations will respond differently to it. But most importantly, we need to be able to respond as quick as possible. Next slide, please. Responding and changing our lives. Why? Well, first of all, because we are struggling with the same travel restrictions that everybody is struggling with. For an international organization that transports people all around the world, that transports cargo all around the world, often at a very rapid pace to be able to respond in a timely manner, it has become a bit difficult today to do so. Today we have three priorities: maintain our existing activities, of course, be able to ramp up our activities and be able to treat any COVID-19 patient, and very important, protect our staff and protect our patients, protect our COVID patients, protect our other patients. And this, of course, go through ensuring that the personal protection equipment, or the PPE as we call it, is available. This requires that all the medical equipment that we need to treat those patients is available and transportable in due time. And it also means that all the drugs and the medicine that are required today are available, and that there is no pressure on the global market for it. Next slide, please. So what is the issue today? What you are seeing in front of you right now is one of the main slogans of our Access campaign, and our campaign for access to essential medicine. This is a campaign that we've launched 20 years ago, and that is relevant today more than ever for a very simple reason. Medicine should not be a luxury. People should not have to die because they cannot afford medicine, because they cannot afford healthcare. And as you can see today, or as you probably see in the news, but to say that we are we struggle a lot with it today. Supply, availability of drugs, of medical equipment is very, very limited today. We are struggling, we are fighting on a daily basis to secure everything that we need to be able to continue running our operations. And most importantly, we are keeping a very close eye on the research and on the vaccines, on the new treatments, and everything that is happening around the world that hopefully will allow us to get out of this crisis. But today we need to make sure, and we call for no patents and no profiteering on any of those aspects, again, because as the slide says it perfectly, one of my favorite slogans for our organization, medicine should never be a luxury. Next slide. I will stop here, and I will now give the floor back. Thank you. And Shirley, if you have any questions on our COVID response, I'll be available later to respond to them. Thank you.
Thanks so very much, Mario. MSF and their teams world over are doing an absolutely fabulous job. It is my pleasure to now introduce our session presenter for the day, Tanya Mathur. Tanya is a qualified psychologist and psychotherapist with over 7 years of rich experience in counseling patients of varying age groups and backgrounds, providing them with therapeutic relief. She's completed an MSc in clinical psychology from Christ University, Bangalore, and is trained in rational emotive behavior therapy and gestalt therapy. Tanya joined MSF in July 2017 as activity manager patient support for MSF's DRTB HIV project in Mumbai. She provides technical support to patient support teams, both counselors and social workers, for strengthening treatment outcomes of patients affected with DRTB and HIV by identifying barriers in treatment and addressing their psychosocial needs. The project aims to develop and implement patient-centered approaches which would eventually contribute towards policy and practices within the national TB program. Tanya is also engaged in different operational researches to explore TB patients' emotional and mental health needs and to push for efforts to improve care for them. As a part of this, she also presented at the Union Conference in 2018 to highlight the needs and the importance of mental health for TB patients. Along with the patient support team in Mumbai, she aspires to continue improving access to mental health care to all citizens across India, and especially focus on vulnerable TB and HIV patients in Mumbai. Over to you, Tanya. All the best.
Hello, hi.
We can hear you, Tanya.
Okay, thanks, Sarah. Hello, everyone, and good evening. My name is Tanya Mathur. I'm a psychologist, and I work with MSF as a patient support activity manager. And I'm here today to talk to you about some of the tips that you could possibly use for your mental well-being during the COVID lockdown. Next slide, please. Okay, so as we know that there is this global pandemic that has swept over the entire globe, and with that, we brought in a new reality for ourselves, which is of social distancing and lockdowns. And studies have shown us, preliminary studies have shown us that extended lockdowns can expose individuals to a lot of stress, which can lead to acute, short-term or long-term psychological outcomes. But on the other hand, studies have also shown us, and experiences have shown us, that mental health can have some positive effect as well under these lockdowns. Next slide, please. So when we talk about who this mental health has, whose mental health has been impacted the most, of course, you have the children, the adolescents, you have the families, the communities, and very like a special shout out to all the frontline workers and the healthcare providers. All of us have our mental health being impacted. And how it's being impacted is that we are reporting a lot of fear of falling ill, of dying, of being infected. There are reports of fear of losing the livelihood or actually losing jobs. We're feeling anxious about losing control over the future. We don't know what our future will hold. There are shutdowns and there are restrictions of movement. So what does this actually do to our mental health? It leads us to have increased stress, increased anxiety. It leads us to having feelings of sadness, worthlessness. We tend to isolate ourselves, not want to talk to a lot of people or not feel like talking to a lot of people. We might also face stigma and discrimination, particularly if we've been infected with the disease as well. But at the same time, like I mentioned earlier, there are some positive impacts on mental health as well that we should focus on, which is that there is boosting of solidarity. People are coming together, communities are coming together to try and help each other out. And there is a sense of increased resilience and coping mechanisms. Next slide, please. So some of the common signs of stress that we might talk about, we briefly touched upon the fear and the anxiety. But if there are some signs of stress, it's very important for us to be aware of them. And the easiest way to do it is to break them down into 4 categories. So if you have been feeling some kind of stress, there might be some physical symptoms like having aches or pains, having chest pain, having a rapid heart attack, heart rate, sorry, not attack, nausea or feeling dizzy. You could also have cognitive symptoms like having memory problems. You could have difficulties in concentrating. One could have poor judgment or having anxious thoughts. Related to the cognitive symptoms would be your emotional symptoms. Some people might report feeling unhappy, anxious, irritable, angry, or feeling lonely and isolated. These then can couple up with some behavioral symptoms of what you would actually see of eating more, sleeping less, withdrawing from others, isolating ourselves, or procrastinating and having some avoidance behaviors. Next. So given all of the circumstances, given the lockdowns, given the kind of stress that we're going through and all the different symptoms that we have, what can we do to really reduce the impact that we have of this stress on our own mental health? So today I'd like to take you through 5 techniques briefly that can possibly help you, and then we can explore them further through the question and answer round as well. Next slide, please. Okay, so the first thing is the circle of control. This is a cognitive behavioral technique. Oftentimes when you're feeling anxious or if you're feeling worried or you're feeling overwhelmed, it's because the problem seems very big. It seems like something that we cannot control, or it seems like something that's not manageable. So one of the things that really helps, and it's something that I like to do for myself as well and for my clients, is to help break down things. What are some of the things that are in my control, and what are some of the things that are not in my control or are outside my control? So if I give an example of this lockdown, and it feels overwhelming because we don't know for how long it will go on. It's been going on for so long as well, and there are very strict measures that have to be taken. So the thing that I can control is how I respond to people, how I'm taking my protective measures to prevent infection, and what are the kind of information that I am coming in touch with, and then also reporting to other people. But some of the things that are not in my control is how the government might be responding to COVID, how other people might be responding to the lockdowns or to the disease itself, someone else's situation. These are things that are not in my control. So it helps to break things down, what's in my control and what's not, and to be able to make an action plan on what I can do. So if I know that I have to respond, I have to be in control of how I respond to other people and to make sure that I am taking protective measures, it helps me to make a plan versus me worrying about what's happening out there in the world, which is something that I cannot control. Next slide, please. Okay. Now, along with having the sense of self-control, we need to have a resilient attitude as well. What is the meaning of resilient attitude? Basically, I'm asking for us to be able to have a shift in our thinking, for us to be able to look at things more positively, which will help us to build in more resilience, which will help us to build in some more coping for us to deal with the situations. It's admittedly not so easy to do, but once we are aware of the kind of thoughts we're having and the feelings we're having, it is definitely possible to be able to switch and to be able to train our minds to have a more resilient thought or a resilient attitude. So if I give you an example of having an anxious thought, which could be that I don't know how I'm going to overcome this. This seems too much. The example that I could ask you to think about, I don't know how I'm going to overcome this, and make it into a resilient attitude could be that life is full of adversities. We've had difficulties before as well. We will continue to have difficulties even after this. If things have passed before and I have found a way to move on, I will find a way again. So that could be an example for an anxious thought. If you have a fearful thought or a fearful attitude, like life will never be the same again, the entire world is under lockdown, nothing seems to be similar or nothing seems to be the way it was. A good example of having a resilient attitude at that point of time might be that things might not be the same again. For sure, things might change and they might change for a long period of time, but that's not stopping things from being good or for us to stop finding the positives in what's going on right now. The next example could be of a helpless thought that I always get stuck in situations that I don't want to be in. I don't want to be in the situation that the world is in today, and I want to just leave it, or I don't know what to do now. A good example of having a resilient thought or having a resilient attitude at this time is that I always have the opportunity to learn from all the experiences, whether they are good or they are bad, and they all contribute eventually to my experience and to how I am and my personality. And then the last example that I might want to give you is of a hopeless thought that everyone behaves selfishly. No one really cares for other people. We could think about this in the example of, oh, the lockdowns, no one's helping me. I have exams coming up, or I have my university things to do, and I don't know what to do. No one is around to help me physically anymore. A good idea to have a switch in the resilient attitude would be that there are examples of selflessness as well. We don't have to assume that everybody is selfish. We might have selfless acts as well, but we might have not paid that close attention to it. So one of the things that I would like you to do while you are going through your own emotions and your own defeating thoughts that might be coming along with it, which is natural and happens to a lot of us, is to also find evidence. Is it really true? Is it really true that this defeating thought is true for me? Or can I find a positive in the situation and then find the evidence for it as well? So it helps me to shift my thinking. So that's something that you could try. Next slide, please. Okay, so now I would like you to take a moment and I would like you to imagine that you are driving with your friend, you're going somewhere. Maybe this was before lockdown. And suddenly the car stopped in the middle of the highway because the petrol ran out of the car. Now this has caused a lot of chaos and a lot of distress because people are honking, people are yelling, and you don't know what to do. And your friend is understandably extremely upset. So you have two options in front of you. The first option is that you might shout at him or her and say, you're stupid, you're good for nothing, you can never get things right. How could you do this? How could you make this mistake? Or would you actually help your friend to calm down and say, it's okay, such things happen. What can we do next? So I want you to think for yourself, what would be the option that you would choose if this was your friend who was the one who had made this mistake? I don't know about all of you, but I will probably choose option 2, where I would actually try and help them to calm down and say, okay, what's the next option? What do we need to do now? Do we need to call someone, or what can we do? But my question to all of you would be, would you have chosen the same option if you were in that position, if you were the one driving the car and actually having the one who forgot to fill petrol? Maybe. Oftentimes we are not choosing option 2. We're choosing option 1, where we are shouting at ourselves and yelling at ourselves and belittling ourselves and saying, oh God, how could I do this? So this brings me to my next point, which is of self-compassion. Can we move to the next slide, please? Thanks. So self-compassion means self-love or being able to be kind to ourselves. And until and unless the compassion does not include ourselves, we cannot truly be compassionate or kind to other people. This means that you need to forgive yourself. It means that you are allowed to make mistakes, that you are human and that you have flaws and that we are all flawed human beings. So when we are looking at self-compassion, please be kind to yourself and the way you would be to other people. Avoid being so hard on yourself because you're doing the best that you can. In all the situations, with all the lockdowns, you're doing the best that you can. Have realistic goals and realistic expectations from yourself and have an actionable plan for it. Try and break things down if it seems too much. Don't expect the world because it might not be possible. And also don't judge yourself. Avoid judging yourself. In fact, practice forgiving yourself for the mistakes that you do that you might make. We don't know if you're going to make for sure. And the other thing would be to practice gratitude or to feel thankful for the things that we have in our lives, for the things that we do for ourselves that help us to be the people that we are. Practicing gratitude actually has shown that it immensely improves our mental health and it actually reduces emotional distress immediately. And this is something that I try and do for myself every day, and also show it to my clients that they practice gratitude every day as well for the things that they're doing for themselves. Whatever they might be, as small or big it can be. It doesn't need to be something humongous. Even something as small as today I felt like taking a break, so I took that time off for myself and I was able to calm myself down. And I'm thankful for that. That's enough as well. So you could even practice gratitude by writing in a gratitude diary. You could write a letter to yourself. You could talk to yourself at the end of the night about how you're feeling and what you're thankful for. Those could be some of the things that you do. And the last thing for self-compassion would be to schedule some me time and indulge in activities that you actually like and enjoy. Because oftentimes it happens that we tend to put the needs of other people ahead of us, whereas we require some love and some care as well, because an empty cup cannot help other people, right? So we need to schedule some me time, fill up our own cups, and then be able to help other people. Okay, next slide, please. And then with self-compassion, you have self-care. They go hand in hand. Taking care of yourself doesn't need to be time-consuming. It's not something that needs to have a separate time for itself. You can incorporate it in your everyday life and tasks as well. So if you are having some mental distress, if you're feeling overwhelmed, if you're feeling a little bit sad, you're feeling a little bit nervous, and you only have 2 minutes in your day because you have a very busy day, and that's understandable, I would request that you breathe mindfully. Notice how you're breathing in and breathing out. Notice how your body feels as you take your breath in and you take your breath out. You could even try eating mindfully and observe the texture and the taste that you have of the food in your mouth and how it feels and how you might actually like it or enjoy it. You could spend time with a pet. You could play with a pet if you have one. Find a joke, things that make you laugh. You could just do something as simple as that. If you have 5 minutes in your day to practice self-care, you could listen to a song. You could have a nice cleansing cry, and that's something that I like to do for myself as well, which is just to let out all the emotions, all the overwhelmed feelings. You could jot down your fears and your dreams in the form of a thought diary, just writing down your experiences of the day, and maybe you could also write down something that you're thankful for or you feel gratitude for. If you have 10 minutes and you can spare 10 minutes, I would suggest that you meditate or you call a friend or you call a loved one and just vent out how you're feeling, what you are thinking, and maybe also listen to them, because shared experiences really do help at this time, and having empathy helps as well. And if you have 30 minutes, if you could possibly take out 30 minutes, you could look at maybe exercising or practicing yoga. And we know studies have shown that exercising or practicing yoga releases the feel-good hormones, which make us feel better about ourselves. If you're feeling a little bit down, maybe you could try exercising or practicing yoga. You could even go back to a previous hobby that you used to enjoy, or there was something that you always wanted to try and you want to do it right now, you could try that as well. And if you don't want to do anything, you just want to take a rest and you want to relax, Don't feel guilty. Watch your favorite TV show. Binge watch a TV show on Netflix or any other channel, and that's fine, okay. That's okay because that's what you needed for your self-care. Next slide, please. Okay, so I would like to finish with the last technique, which is of relaxation and grounding techniques. Now we know that relaxation techniques, meditation, they really help us. And I do want to emphasize on the fact that they do help us to reduce the intensity that we feel, that we might have of negative feelings. And it also helps us to step away from the situation and to really be able to see if that's something as overwhelming as it needs to be, or if it is, to just help us take a break and to help us feel relaxed. So right now, I would like to just have like a quick exercise with you, where I'd like you to take 2 seconds, and if the laptop is on your lap or if you're lying down somewhere, to just sit up, keep the laptop next to you, and place your feet firmly on the ground. And I want you to close your eyes. As you do this, I would appreciate if you would take slow and deep breaths. Observe how your breath is going in and out, in and out. I'd now like you to state the date and the time and the space that you are in to yourself. You can say it to yourself. And to remind yourself that you are in a safe place right now and that you're going to be okay. Focus only on your breathing. And I'd now like to try the 5, 4, 3, 2, 1 technique with you. Open your eyes and in your mind, look at 5 things that you can see around you, around the room that you're sitting in, if you're outside, wherever. Next, I'd like you to think of 4 things that you can touch. Anything that you can touch that's around you. Maybe your clothes, laptop, anything that's around you. And how it feels when you touch it. Next, I'd like you to focus on 3 things that you can hear. It could be birds chirping, it could be the sound of the AC, maybe a family member who's walking around the house, anything. Focus on it. Next, I'd like you to think of 2 things that you can smell right now. How does it smell? Is it pungent? Is it sweet? Is it neutral? Focus on it. And last, I want you to think of 1 thing that you can taste right now. It could be of the last thing that you ate. Is it sweet? Is it sour? How is it? Think about it. Focus on it and only on it. Great. And now we'd like to end this little exercise with a small prayer of gratitude that you might want to say for yourself. Take 3 deep breaths in and out. In and out. In and out. Wonderful. So this is an example of a grounding technique that you could use for yourself. I hope you're feeling better. And we can just move to the next slide now, please. I'd like to leave you along with these 5 specific techniques with some general tips as well. Stay informed about coronavirus, know what's happening around you, but limit your media exposure. Try and maintain a healthy lifestyle devoid of any other substances, and maintain a daily routine. Have your routine as close to normal as possible. Those who are isolated or living alone and need help them, because this is a time of social solidarity as well. We need to come together. And remember, these lockdowns are about physical distancing, not emotional ones. So make sure that you are reaching out and talking to loved ones and connecting with everyone. Next slide, please. So at the end of this presentation now, if I could leave you with some key takeaways, it would be this. Please be kind to your mind. You're doing the best you can. Absolutely, whatever is best for you, you're doing it. Identify one or two self-care strategies. They could be from the presentation today, or they could be something that you have maybe heard about outside, but those strategies that work for you, and practice them regularly for them to actually work. Practice some relaxation or grounding techniques that might help you to reduce the overwhelming feeling. Try and connect to the community at large, which will help you to increase your support and social solidarity. And last but most important is please reach out to a mental health expert if you continue to feel distressed or if you continue to feel overwhelmed. Thank you. So this is the end of my presentation. If I'd like to invite Sarah back here and then we can have some questions.
Thank you, Tanya. Wow, I think I'm more relaxed than anybody else now. I can almost feel my breath. Thank you so much. Thoroughly insightful, and in this short few minutes, you've introduced a lot of concepts and brought in a lot of words and a lot of things for people to think over. So really appreciate all the inputs on this. And we'd now like to open the floor to questions. So please feel free to type your questions in the chat, dear audience. In fact, we've already got lots of questions coming our way. So while the rest of you type, maybe I can start the first of the questions with Tanya. So the first question I think that has come to us, Tanya, is from somebody who asks that is crying a sign of weakness? Because social media is always telling us to smile and get over our weaknesses and to control our emotions. Why be anxious? But what do you think? Is it a good idea to just cry and let it out, or is it only for weaklings?
I think it's a brilliant idea to cry it out. And it's something that I was talking about with the self-care technique as well. Crying is actually an extremely therapeutic a way of us to release our emotions and to be able to feel a little bit better. It helps us to vent out. And crying does not equate to feeling or having depression. I think sometimes people feel this need to keep it in because I don't have a problem. I'm absolutely okay. Nothing is impacting me. But the more authentic we are with our own selves and how we feel, the easier it is to be able to reduce the emotional discomfort. So yeah, I would say that crying is good. It does not equate to you having a mental health problem. It just means you're human, and that it sometimes means that you're getting overwhelmed. That's all.
Okay, fair enough. Thank you. That actually brings a lot of puts to rest a lot of anxiety that a lot of people have, that you shouldn't be really perceived as weak. And when it comes from someone who's licensed to say it, I think it sounds even better. Thank you.
Yeah.
Our next, before I actually go to the next question, Mario, thank you for joining us. If there are any questions addressed to MSF and their quantum of work within the region, they will be addressed directly to Mario. So people, please feel free to send in your questions there as well. Just moving on to the next one, Tanya. Somebody is writing, they've loved the relaxation technique just like we all have. And the person asks that their life at the moment, I'm assuming it's a student, is full with online classes, exams and things like that. But once the summer break begins, and they will of course have a lot of time to do a lot of stuff. But what do you recommend? How does one indulge in the right kind of self-learning? I mean, is there any one method, and how do you keep motivated to keep learning in without actually breaking the momentum, like doing one thing today and then becoming a jack of all trades and really not finding your path? So what do you think on that?
Okay, that's an interesting question. I think there are a couple of things that I want to touch upon. One is there is this fear that if we have too much time and we don't utilize our time effectively 24/7, then I'm failing. And I think that that's something that we must absolve ourselves, that we're not going to be able to, these are not normal times, these are not normal situations. It is an emotionally intensive situation as well. So if you don't feel motivated all of the time, One, it's okay, it's fine. I would rather focus on you trying to find what are you feeling so overwhelmed about? What is the thing that is stressing you out? Figure that part out. Figure what are your defeating thoughts, and then be able to look for evidence to move it into a more resilient attitude. Something that we were talking about a little bit earlier as well.
Perfect.
The other thing that I would like to talk about is, yes, university stops, online classes stop, and you suddenly have a lot of time. And that's where the importance of having a routine comes in as well. There's usually a tendency as students, and even I've done this, that, when you are in school, you are like absolutely all the time on go, go, go. And then the minute you have holidays, you just tend to like not want to do anything at all. But I would encourage, and especially because now there is restricted movement, do try and maintain your routine as close to it as possible. You could have many different variety of things that you can try, like do hobbies. There are so many online classes that you're interested in that you could join, but maintain a routine as well. So I think these two things together will help you to stay motivated, but also try and practice self-care. Like if it's not something you're very excited about right now, it's okay. Be authentic. It's fine.
Fair enough. Okay. Our next question, we're actually bombarded with questions. You're going to have a lot of talking to do. Our next question comes in from probably someone who's working as well. The person's written, it's hard to move away from work now that home life and work life has merged almost indefinitely. So how do we effectively create this distinction? And I think probably I'd like to add from my side, how do you even expect your team or your employers or your teachers in this case to understand that your time is, you do have a personal time as well. How do you encourage that kind of thing?
Yeah, and I think that a lot of the working professionals are having these difficulties, where earlier there was like a very strict time, because when you were in office, you were in office, and when you were at home, you were at home, and these boundaries have sort of blurred right now. And that's where my point of having a routine comes into play again, because like that's the first part of it, that you continue to have a routine, you still maintain your 9 to 5 job, and you just you let your team know that I'm sorry, but I'm not going to be available after this time. So if there is an increased workload, maybe you can consider that there was some travel time and things like that. So maybe you can give yourself an extra hour or an hour and a half. But the time that you need for yourself and for your family is sacred, and it just needs to be put out there that beyond this time, I'm sorry, but I'm not going to be available. And I think that if all of us together try and maintain these boundaries, it's going to be helpful. And I don't know, I'm sure that people will be able to understand it as well. But sometimes we feel, oh, how will the person in front of us feel? We're saying, no, we don't want to work anymore. But it's just about asserting ourselves and saying that this is for my own family time, and I need that family time. And it's not up for debate.
Fair enough. I think we should all take note of this, because I think the borders have just merged right now, and it's very difficult to really find time for yourself and focus on that little me time. We've lost that me time in the entire rut of things right now. There's one more question that asks, and it's a very valid question on this, that ignoring your feelings and putting it away and obviously ruminating over negativeness is not a healthy trait, goes without saying. But some people really just don't know how to express themselves using words. How can you reach out to such people, or how can such people reach out to someone else when words are not with you really don't know how to communicate your anxiety, your anguish to somebody else? How can we help such people?
That's a really nice question, and I think it's very, like you said, it's very valid, very, very pertinent, that not everybody can emote or sort of have that kind of communication style as well. But it's also important to note that there are other techniques out there as well that don't require you to only talk. If you are creative, you could paint. Painting is an extremely therapeutic, like art therapy is an absolutely branch of itself, where you can emote yourself using painting, using coloring. If you are having a lot of angry thoughts, something that I like to do with my clients is asking them to use crayon and to really color it out, remove all the frustration using crayons. And that incidentally works well with both adults and children, because all of them, and they do it fabulously. You could try, if you want someone to feel more relaxed, you could try and download mandalas from online. They're like round circles, and you just need to color them in. So it requires a lot of, it's like mindful coloring, and it's actually very, very helpful to feel a little bit relaxed. If you feel like it's too much and you want to reach out to a mental health expert, also please know that not all mental health experts only use narrative forms of therapy. A lot of them use dance, they use music, they use art. There is a lot of things out there. So don't feel like that only talking is the only way in which I can express myself. You could even write it down. That's like having thought diaries. One of the things that I was talking about is jot down your fears, jot down your thoughts all through the day, and that helps as well. That's extremely cathartic too. So there are a multitude of experiences that are out there that are apart from only talking.
It makes sense. Makes a lot of sense. Journaling is in fact quite in as well these days. A lot of youngsters have taken to writing their thoughts and posting it online. So yeah, it's definitely one of those bright new ideas here. The next question actually I'd like to address to both of you, to both Tanya and to Mario. How about how do you work with the stigma towards COVID-19 patients? Is it a big issue for some to feel this disconnect and isolation, because of their health conditions? How do you fight this stigma? Though we all know people bounce back, they come back. Unfortunately, we do lose some loved ones, but most people do come back. But the stigma is still very large. So how do we deal with this? Any of you, maybe Mario, with you, if you'd like to address it as the MSF head, maybe.
Let me respond quickly and then let Tanya actually feedback on this, because her perspective in terms of what she does is crucial here. But I would say, in a way, I want to say we need to talk about it, as simplified as that is. There is a stigma, it's a stigma towards our patients, it's a stigma towards our staff, and sometimes that stigma can appear in the most unexpected places. It could be right at home with your partner, it could be in your community. The way we work is always ingrained in the communities that we serve, and we work with those communities. So we discuss that with the communities, and we will hold sessions about health promotion in general, depending on the messages that we pass. And this is definitely one of the ways that we address it all around the world. And it's not just about COVID. Unfortunately, the issue of stigma is something we witness all too often in our projects all around the world, depending on the disease. And again, as I was saying in the beginning, the strength of this virus is its weakness. This is not something that you necessarily show. I could be carrying it now and not have the symptoms. You could be carrying it and not have the symptoms. I work for Doctors Without Borders. It could be that somebody in my building today, when I come back home, doesn't matter if I'm sitting in an office behind a desk and I'm working, will recognize me and go like, oh my God, you are dealing with COVID patients, stay away from me, etc. Unfortunately, it is a reality. So this is more at a personal level, and luckily it hasn't happened to me, but we know for a fact it's happening to a lot of our staff. But I'll let Tanya compliment from a more medical or more health promotion side of things.
Perfect. Thank you, Mario. Tanya.
No, absolutely. Like what Mario mentioned, that in the heart of what we do is to look at the vulnerable communities and how we can support them. And a big part of it is talking to them, engaging with them, and spreading on a lot of awareness. So the whole idea about having health promotion is to be able to go inside these communities, talk to the key stakeholders. We could have community leaders, you could have youth leaders, you could have like the community school teachers and the principals, and really speak to them about what COVID actually is, how does it spread, like giving them factual information, and at the same time also managing the rumors that spread around very, very quickly about what COVID is. So it has to be a balance of giving factual information and then debunking the myths and the rumors that are being spread around.
Perfect.
That's something to look at.
Sorry.
Yeah.
In fact, just taking it, a step further, the same question really. One is the stigma. Second is how can we cope with the loss of a loved one in these pandemic-based situations? I mean, it's very unfortunate, but things have happened. We personally know people. All of us personally know people who lost somebody in their family at some stage because of the pandemic. So, how do we deal with this kind of trauma?
Absolutely, it's a very relevant question that you asked, and it is an extremely unimaginable and difficult way to even lose someone, particularly given the circumstances that are going on right now. I would, however, still say that this grief of losing a loved one is as it would be if you had lost someone even outside of this pandemic. Because grief is grief. Losing a loved one is a huge loss, an unimaginable loss, and it's not something that we can possibly overcome in a day or two, or even in a week or two. So my suggestion would be, if that there is anybody in the audience who unfortunately has lost a loved one, especially due to COVID or maybe otherwise, please reach out to a mental health expert and talk to them, because there's an entire process. You need to grieve through the entire thing to be able to go into the other side. And yeah, that would be my main advice for all those out there.
Yeah, it totally makes sense. I think you need that little closure somewhere. Sorry, Mario. Please
No,
go ahead.
I just wanted to compliment also from our programs. Grieving in a lot of communities, in a lot of countries around the world, or let me say in a lot of cultures, is also associated with very specific rights. Rights of death, depending on the culture, depending on the religion you're in, but there are a series of codes all around the world that people want to respect or want to follow in order to make sure that the loved one, is buried according to their customs, their religion, their tradition. Again, unfortunately, this is not something new to us. This is something that happens. We have our patients, sadly, that sometimes die in our clinics, that sometimes die in our hospitals. And what we do is we work with the community to make sure that there is no infection, or that if there are health authorities measures that are in place, like they are right now in the case of COVID-19, we will work with the communities to see how we can allow for the rights to be performed, how we can allow for the whole traditions to be respected, while at the same time ensuring that nobody gets infected, and this is valid for, unfortunately, many infectious diseases and many pathologies where we have to take very specific precautions, because last thing you want is for somebody else to be contaminated. But this is something we have learned, sometimes the hard way, I'll be very honest, to work on throughout the years.
Fair enough. Yeah, makes sense though. There's one more question, and I think this is something that has affected pretty much everybody around the world. So a lot of people, both youngsters and adults, have resorted to substance abuse to be able to cope with, this whole tangle of emotions during this lockdown. So how can you actually control such temptations? Is it even possible, when you're in isolation and your mind is going into a tizzy, what do you do? How do you keep that substance away from you?
Right. No, that's a very relevant question again, Sarah. And one of the things that I would like to bring to everyone's notice again is, where is the need for the addiction coming from? Most of the times there is an underlying distress or emotional disturbance that leads us to have these unhealthy behaviors. And addiction is one of the unhealthy behaviors or coping mechanisms, because they help us to feel momentarily, they help us to feel better. So I would again encourage, and of course the advice is to try and avoid all kinds of substances and alcohol. And if you do feel a lot of disturbance and you feel the need, or there is some pressure amongst the students or from anybody really, that try this, it will make you feel better, please speak to someone again. If you are feeling like, oh, things are going out of my control, I'm not able to manage this, and I want to now start consuming some substances, or I want to just try, because no one really says I'm addicted. They start with trying, and then they tend to want to go more and more into it. So my suggestion would be, please, if you do feel very traumatized or disturbed in any way, talk to someone so that then the appropriate help can be given.
Fair enough. It's actually a sweet question. Someone says, I talk to my friends every day, I'm still lonely. How do I deal with this? I might have worked up to this scale.
Yeah, and I'm sorry that you feel lonely, even though you talk to people, and that's again very common because we can feel alone and lonely even in a room full of people. Because what we need is emotional connection. We don't want physical connection, but we want that emotional connect. And unfortunately, if it's not possible or it's not happening with the friends for some reason, maybe try and find someone else who either is like someone you're comfortable with, or again try and journaling and writing down your thoughts and your feelings. If you feel a little bit embarrassed and don't want to talk about all of it to someone for fear of judgment, you could write it down. Basically, the idea would be to vent out how you're feeling, and then when the intensity is a little bit better, maybe try and identify that one person who could be your person, and then talk to that person. Yeah.
Yeah, I like the word my person, your person. It's I think a lot of TV series have been making it popular as well. So a lot of shows online.
That's true.
Being someone's person. It's a very good
being
thought.
that person. Yeah, like I want my person, mine.
Yeah. It's a very pertinent thing to have actually, and people are lucky if you have that one person with you. True.
Yeah.
This is a very interesting question actually that's come in. How do we start a conversation with the older generation regarding the necessity to be safe in a pandemic? Because most of their opinions are religiously controlled or culturally controlled. So how do you get them to change that stance? And I'm loving this question, absolutely.
Yeah, that's a very interesting question. My advice would be to tackle it using facts, explaining what's going on out there. Sometimes we tend to have more focus on our own belief system versus, which may or may not be the absolute like synchronized with the facts out there. So you could try and speak to them about what's going on, or have them talk to someone else. Sometimes it also happens that there is this generational barrier where the gap, so to speak. So having someone else speak to them as well, that could help. Maybe a friend or someone who's working in the industry with COVID and sees what's out there, and they could talk about it. Yeah, Mario, I'm not sure if that's something that we're doing in MSF as well.
Yeah, Mario, could you throw some light? Yeah.
So, sorry, the connection is not great. Can you repeat, Tanya, what you were asking?
No, I was just asking if there's something specific about MSF that we want to speak about over here, how we are dealing with the fact in Dubai, keeping in mind the cultural context.
Let me readdress the question to you, Mario, in case the connection was lost there. The question actually was that how do you help or how can you actually talk to older people who are, bound by cultural and religious norms and beliefs? Does MSF do anything to help, people probably adjust better or understand better that this is a serious pandemic and needs some different approach?
Sorry, if I understood, I'm very sorry. I don't know what's going on, but the alias of the internet. But if I understood correctly, it's about the question about MSF and how we are able to handle the different generational aspects, basically, when it comes to discussing that. Am I correct? Okay, I'm sorry for that. Okay, now it's getting back. It's getting back to normal. Yes, again, I think the key for us when we do this is really when we work with the communities. And I think, there is almost an anthropological aspect to it, because we don't believe that we are able to succeed in treating people successfully if we do not understand the communities we are in. And in a lot of communities, the role of the different generations will vary or will have a specific, importance. So what we believe is finding the appropriate channel with the appropriate category of people. It can be working with youth groups. It can be working with the elders in some more traditional places. It can be working with religious leaders, because we know that that from a religious perspective, some messages or religious leaders themselves will have a certain respect that we will not have. We will sometimes devise ways of exchanging and interacting together with them. It could be, in some cases, it could be a puppet show, or it could be a drawing competition, or so all I want to say is that this is a real challenge, like everywhere. And maybe just to repeat a bit what we said, it's not only through talking that you do it. So it's really finding the appropriate mean that will speak to people, but also finding the appropriate group or channel through which it will either become at their level an intergenerational discussion, or we will have separate layers or stratas of discussions with, one generation and then the other generation. I have to say, it sometimes can be very, very, very complicated, and thank God that it's not just about language, because I've worked in many places where I simply did not speak the language, and people definitely only spoke, the local dialect. So you're going to need to find a way to communicate on that. And but again, nothing, things we have learned to do throughout the years.
Fair enough. I have one more question, and this is probably a funny one. The person asks, is it okay to not be concerned about what is happening in the world? So is it okay to be disassociated and stay disassociated and not really care? Maybe that's what works for that person's mental peace. What do you think, Tanya?
Yeah, I think it's a tricky question. Yes, it's okay to not feel overly concerned and to feel overly anxious. But just make sure that it's not happening with everything. I would want to keep a check on how much it's happening. Is that a coping mechanism for us? And see, like the coping for us right now, it's okay, because it really is overwhelming, and we're all trying to do things in our own way which can help us, and that's absolutely okay. So in a nutshell, actually, I think it's okay. If you don't feel too concerned, it's fine.
If
Yes,
Sarah, if I may add to this, my own personal coping mechanisms to share, and I've been an aid worker for over 15 years now. If I don't switch off at times and feel completely unconcerned by what's happening around me, or rather just choose very specific things I like to be concerned of, which are usually around my loved ones and my family, if I don't do that, I don't manage. So I just want to reassure you, I spend my day being concerned. This is what we do. We are concerned. And there is a moment at the end of the day when I come back home, I switch it all off. I don't want to hear anything about anything, and I just focus on 2-3 things that will re-energize me and give me that breathing space. So this is coming from veteran aid workers. So please do not feel bad about it at all. I do that on an almost daily basis.
Yeah, perfect. So it's good to hang on to your sanity, and you don't feel guilty about it either. Great. We just have a little more time for a few more questions. I'm going to be very specific on these, but there's one person who has written to me 3 or 4 times the same question, actually, so I absolutely feel we need to address it. This person says, I feel angry, annoyed, upset over the tiniest things, and there's no mind space really to do anything. It's been so many months, few months that we've actually gotten into this. I feel caged all the time, and I can't get over these thoughts. Please help.
Right. Okay. Yeah, it's absolutely understandable, and I really do feel for you, because there is a lot of frustration with respect to the lockdown. We want things to go back to how they were, and if I may, I do sense some level of feeling overwhelmed and hopeless, which is natural to feel in these times. What could help is the first technique that I was talking about, which is things that are in my control and things that are not in my control, to be able to differentiate between the two, and to then be able to make a plan on things that I can control and that things that I can do. Because otherwise it tends to be a general frustration and a general anger, and it's very hard to manage that. So my suggestion would be, try and break it down. What exactly is bothering you? and what are things that you can do about it, and what are some of the things that are not in your control, unfortunately, and have to be parked for some time. Yeah, that's something that I would suggest this person to do.
Perfect. Now, the last question for you, Tanya. So social distancing is not a privilege that everybody can afford to have at this time because of whatever reason. So how do people cope with this? And honestly, what is, what can be perceived as a long-term strategy that you can, use to endure the moment? Because we really don't know when this is going to end, if it's going to end anytime soon or how much it's going to stretch out. So is there anything in terms of a long-term mechanism that people can build as part of their life so that this doesn't feel like a burden and you slowly and gradually get used to it, not unwillingly though?
Sorry, there was a little bit of a network issue. If I understood well, you asked for long-term strategies to be able to cope with the lockdown.
Yes, and not just lockdown, but also the concept of social distancing. This because see, not everybody can be socially distant because people need to go back to work, parents, friends, this, that, and the other. But how do we actually cope with this whole idea of being socially distant yet being absolutely sane, even if it's in the long run, even if it stretches out over the next year, for example? How are we going to deal with this? Any takes on that?
Okay, no, that's an interesting question. And my suggestion would be to, again, try and find out what are the things that are bothering you the most about this lockdown. What are your emotional disturbances and where are they coming from? And to be able to find some kind of self-care strategies or relaxation strategies that help you. They take time, they take practice, and oftentimes what I've seen is that we try one or two things, we try it once or twice. If it doesn't make us feel better, we tend to let it go and just say nothing works or maybe move to the next. But what I would really ask and request is that things that resonate with you, things that help you feel better, stick to it. Try it for a long period of time. Let it become a part of your life. So, for example, feeling gratitude for things that you do have. It is easy to focus on the negatives, and there are a lot of negatives out there, and we cannot take that away. But there might be certain positives as well. So, looking for the positives, feeling thankful for it, feeling thankful for the fact that you are able to get up every day and do whatever you can do in your capacity every single day, and give yourself that time. I think that plays a very, very big role in maintaining your mental health, especially in these long-term pandemics. So feeling gratitude, not judging ourselves so harshly, trying and finding relaxation techniques that work for us are some of the things that I would suggest. And the last thing I want to emphasize on is that absolutely this is social distancing, but this is not emotional distancing. So please continue reaching out to people, continue talking to people, even if it's not face to face, which was our normal. We can find a new normal, which it could be, maintaining that 2-meter distance and talking to people if the government allows it. It could be video chatting with people. So emotional connection doesn't need to stop just because social distancing has come in.
Very well put.
Those are the things.
Perfect. I just have time for one last question, but that would be addressed to Mario in this case. And then I'd request you, Tanya, to do the key wrap-up points for me. So Mario, just for you. So in other countries, this comes from someone who's interested in working and volunteering with MSF. So this person asks, in other countries, is it possible to volunteer and directly help with the situation at any moment of time? Is there anything that we can do in Dubai right now? Or is there other options, any other options available? Could you maybe help us with this?
Yeah, absolutely. I mean, I'll answer in 3 parts. First of all, just for people to know, as a professional organization, we hire professionals, and in the sense that when you work for Doctors Without Borders, you get given a contract, you get given a set of responsibilities, you get your credentials checked, you get your certifications checked, you get trained. And then you get deployed to the field, because we provide free medical health care all around the world. And if we are not providing, the top quality, and we are not having the appropriate people dispensing the care, it's not going to work out for us. So as an organization, we the medical care or the support functions that we have, because we're not just doctors. I'm not a doctor myself. We have logisticians, we have accountants, we have drivers, we have cooks, we have guards, we have people in charge of the laundry in the hospital. So we have a whole range of jobs basically that people can apply for when you work for Doctors Without Borders, but very few of those are based on volunteering, in the sense that we need to be able to hold you accountable, and it is a full-time job. Now, having said all this, usually in offices like our office in Dubai, where we do not run medical activities, we will sometimes require volunteers to support us in some specific campaigns and some specific actions. So if anybody in Dubai is interested, if you go on our website, and I'll give you the handles in a bit, but if you go on our website, there's a part called Volunteer with Us. Please apply on that volunteering bit. Your details will be added to our database. We will ask you a few questions about your qualifications, your skills, and do highlight them. And then whenever we have a need, we go to the database and we will match you, and we will match your skills and your expectations with what we can offer. And this is the best way of doing it. Now, my final answer, because I said it was going to be in 3 parts, the best way to support Doctors Without Borders today, if you are not working with Doctors Without Borders, is to support us financially. Doctors Without Borders is an independent organization. Independence is one of our key principles. What does it mean? It means that we do our assessment of any needs independently. We decide by ourselves to intervene, not based on any type of agenda. And in order for us to do that, if we are not independent financially, it is difficult. If we rely on funding from government sources, we might have to follow some directions. So our strength is our independence. The best thing you can do for Doctors Without Borders is support our independence, and this, believe me, means that we are literally all together.
Thank you, Mario. Thank you so much. So before I let Tanya go away, are there any parting thoughts that you'd like to give us, just to summarize this? So any key takeaways that you'd like to summarize the session for us with?
So are you talking to me, Sarah?
Yes, Tanya. Yes, sorry. Yeah. Any key takeaways that you would like to give the audience before we let you go?
Yeah, some of the key takeaways, and I would like to reinforce from the presentation, and even after hearing all the questions you have, is again, be kind to your mind. You guys are doing fantastic. You're doing well. You're doing things that you can to the best of your capabilities. Have that self-compassion. I know it's difficult to do it. We all struggle with it, but try and find that self-compassion for yourself. If you are finding yourselves to be too overwhelmed, please reach out to a mental health expert. And now you have the Wellness Hub as well. So you can write to people, you can reach out to people. There's enough and more support that's out there. And I hope that some of these strategies that we've discussed today help at least some of you to feel a little less distressed and to feel better. Yeah, that would be my main thing for you. And I have so much gratitude for all of you, and thank you for letting me be a part of this presentation and the webinar.
Oh, thank you so much, Tanya. Really, thank you very, very much. Very, very well put, short and crisp words, but that's, I think, exactly what we all needed to hear. So just a note to all the attendees, you will be getting a feedback survey at the end of the webinar. Of course, it will be sent to your emails, and a document of the entire presentation done by Mario and Tanya today. And at any point of time, if you feel like you want to reach out to us, you can write to us at the Wellness Hub at manipaldubai.com, and we'll be happy to forward all the questions, all the answers. And just before we kind of wrap up the session, I think my little takeaway from this as well. So now, fear and anxiety are common reactions in situations of uncertainty. Yet, it's vital to realize that challenges obviously make us stronger. So the key here is to work together as one community and create a sense of solidarity that will help us cope with this pandemic situation. So empathy, support, compassion, kindness, these are all positive emotions that we need to foster within ourselves, as Tanya has been constantly talking about throughout the course of the session. So make sure that you socialize virtually, you practice mindfulness, be grateful, be informed, Condition yourself to tolerate uncertainties and play to your strengths. A wise man once quoted, "At the epicenter of the storm, it is always calm. Find that center, your center, and play to your strengths." And before we log off for the day, I'd just like to invite Mario Stephen once again to give us or to introduce their call of action from MSF. And then I think it'll be time to say adios.
Thank you very much, Sarah. Thank you all for having followed and for those questions. I did enjoy it as much as a spectator as you are, and it was great hearing my colleague talk to us. You want to have more information about what Doctors Without Borders does. Here are the Facebook, the Twitter, and our websites. Of course, we will have others around the world. As I said, we're big organizations, but those are ones that can bring you information a bit closer to you. And to finish on the financial support, I think it's very important to remind everybody that financial support to organizations and charity is very regulated in the United Arab Emirates, and we need to be very mindful of the law and very respectful of the law, of course. So we run campaigns that are duly authorized and that bear the appropriate permits from the authority. So would you like to support Doctors Without Borders, or would you like to diffuse the call for action for others around you who would be able to support us? You will have the website. We partner with Yalla Give. It's yallagive.com. It's our third-party platform that helps us raise the funds, again, as I said, in all legality. Please feel free to click and support us in that sense. And as I said again, because it's very important, rest assured all this is done in all legality. And I'll finish by saying our information, our news, our reports tell you very simply what your donations contribute to. Remember the independence, but also our impartiality and our neutrality in treating patients all around the world is really what the most important thing is here. And as I like to say it, and as you've been hearing this phrase, I feel a bit annoyed sometimes because I think people have stolen it from me. But I like to say we are all together. It is truly a collective effort. I'll leave you with that. We are together. Thank you for having followed us, and thank you for having listened to us.
Thank you very much. Thank you, Mario. Thank you, Tanya, for answering all our queries ever so patiently. Thank you to the attendees. We hope this session actually gave you some renewed sense of hope. Feel free to reach out to us. Once again, it's okay to not be okay, and you are definitely not alone in this. So time to sign off. Do reach out if you ever feel the need to. Thank you very much and stay safe.